Good morning, one and all. It's nice to be with you all today to discuss about the challenges we've been facing all these 2 months and what we are yet to face the next coming few months. And we'll discuss about few things what as parents we should know. And I kindly request all of you to mute yourselves so that this discussion is going to happen for 20 to 30 minutes. After that, you can unmute yourselves and ask your queries, or else you can text your queries in the chat box so that all queries will be answered at the end of discussion to avoid unnecessary prolonging of this session. Almost 2 months ago, we were at this stage. There was this announcement of lockdown. It was mixed emotions initially. Then in a day or two, we all had high expectations. We all thought that this is going to be a family time. We're going to spend time with kids drawing, painting, gardening. But slowly we realized that with no domestic help, we really got busy into the household works, cooking, cleaning, washing, and we even got bored of those routine. Finally, we ended up cooking some exotic dishes. We also explored our own terrace, took our family, we played, we did some few Zoom calls with our friends and relatives. And we also realized that this lockdown is not only Netflix and chilling, but we had a lot more to do. The true reality is that the house always looks like a mess. This is definitely not an exaggeration. This is how exactly even my house looks today. So, with all this, there were too many facts and suggestions making us even more anxious. They said when we were asked to clap hands for the frontline workers, we contributed it that to clapping hands would destroy the coronavirus and will not let the virus come to you. We also had some news about our traditional Indian rasam, like having pepper and turmeric will prevent you getting corona. And there were all few other messages or few queries like newspapers can spread. You can spray alcohol-based solutions on the body to prevent getting infected from coronavirus, and so many more, just making us more anxious. With all this around, we managed to work from home. Few of us actually continued going to work as well. But here we are now at the end of 2 months. Few schools have already started the online Zoom classes, and we expect our kids to be very sincere sitting in front of the desktop or laptop listening to the teachers, but that is our expectation. We'll see what is going to happen in reality. So, in reality, we have a physically and mentally tired parent and a bored or a sad or angry kid. So, these are few challenges what I thought every household faces of late in this last 2 months during this lockdown period. Some as children are inside the house 24/7, there is an increase in incidence of household accidents because of the potential dangers at home. There is a disruption of routine, sleeping, eating, and sometimes there is overeating. There is an increase in screen time, increase in aggressiveness among children and family members. We have problems with online Zoom classes. There are a lot of queries on handling daily use products and with so much of myths going around about coronavirus. So what can turn dangerous at home? We as adults, we all are aware that children can meddle with anything and turn them dangerous. We all are aware of things which are available at home with which they can injure themselves. But this is just a recall so that we remember and recall and keep things safely. For example, electrical equipments, plug points, iron boxes, induction stoves, they can either get burn injury or electrical injury. Cleaning and washing agents, these toddlers are very curious. They cannot sit in some place. When you are busy with household chores or working from home for the office, these children silently go to the restrooms or they go to the kitchens where these cleaning agents are kept in cupboards. They are curious, so they open and they try to smell. They even try to drink if it is colorful. So these are corrosives and cause severe injury to oral cavity, mouth, the food pipe, and the stomach if ingested. We all know how dangerous are the sharps, and the special mention on the naphthalene balls and camphor because these are available at home more often, and this camphor, when ingested or inhaled for a longer time, this can cause seizures, which is called fits, and this can cause abnormal lethargy in your child because camphor is used as a medicine for cold and cough, and they are sometimes rubbed on the chest. When this camphor is rubbed excessively on the chest and children inhale them in larger quantities, this can cause abnormal drowsiness. We have a lot of children with this presenting with camphor ingestion or camphor inhalation, leading presenting with seizures. Mosquito repellents need a special mention because this is a product which is there in all households. So this mosquito repellent has a compound called pyrethroid, and along with that it has a solvent kerosene. This kerosene is a hydrocarbon and again causes CNS depression, which causes lethargy and abnormal drowsiness in children. Can also cause some breathing difficulty needing hospital admissions. Also mention about pain relief oils. When we have a elderly adult at home, we have all these medicines. There is no clear data on what it has. There's no mention of the composition, and this makes it even more dangerous. And with children coming behind you all the time, there is increased risk of burns or scars from hot liquids or coming in contact with hot vessels. These are not imagined things. These have been these are the few patients who come to us more frequently in the last 1 or 2 months. Of late, we have had almost 4 or 5 patients in just 10 days time with accidental ingestion of thyroid medicines. These medicines were kept in the home, used by the elders or parents themselves. And because elders, they get bored, they tend to forget more and leave these medicines, they misplace it and they forget. And when it gets to the child's hand, then it can turn dangerous. So remember to keep all these medicines safe. Accidental ingestion of metallic foreign bodies, coins, magnets, and button batteries. All these, when if it is a smaller in size, when it is smaller in size, when ingested, it comes out easily. But if it is of a larger size, or if it goes to the windpipe, that is the breathing pipe, then it causes a lot of problems. Here a mention on button batteries. These are batteries which are round in nature and is there in our TV remotes. It is there in most of the recent toys of late. Sometimes when the screws become loose, these button batteries fall off from the toy, and these kids are very curious. They want to taste the metallic taste of that battery, and finally they take it and swallow it by accident. This is alkaline in nature and can cause as serious injury as a corrosive ingestion. And jumping from heights, as we know, causes laceration and fracture. And with children at home, is going to be more frequent. So coming to the next challenge, as we say, there is a complete disruption of routine in most of the houses. On an average, there has been a delay of 1.5 to 2 hours in starting a day during this time. So we start a day late. We are stressed, we are angry, we are tired, we rush upon our household chores, we rush for work, then finally we scream at others, everyone gets restless. There is a delay in everything, and finally at the end of the day, we are exhausted and we think and we expect us that we need to have some relaxation because we worked all through the day. Finally, watch some movie or play some games and tend to sleep late, and the cycle continues. So how do we break this? This is difficult, but still you want to get back to if you want to get back to routine, you have to sleep early. That is the first thing. You sleep early and then you expect others to follow you. So you wake up early and you promise to wake up kids 15 to 20 minutes early consistently every third day. Don't be very strict about the timings. For example, if on a routine school day, if your child wakes up at 6 o'clock, make sure that your child wakes up at least before 7, even during the lockdown time. Then if you wake up early, everything else will fall in place. This needs a lot of patience, planning, and practice. You cannot just give away this because it didn't work out in just 1 or 2 days. This is going to take a minimum of 1 week to 10 days to work out, and you have to be consistent with your plan. So a small mention on overeating. Suddenly we realize that our kids have a higher appetite nowadays. So what is this actually called? This is called as emotional eating. Boredom and stress are the two big contributors to emotional eating, and our children have a lot of both right now. This is related to the environment and to the parental modeling. So what is the remedy? We all know what is the remedy for this boredom and stress. It is a structured activity and keeping the children engaged. I know at this time, with the parents struggling to do household chores, working from home, worried about pay cuts, and supervising online classes, entertaining children is a Herculean task, but still not an impossible one. Next is the increase in screen time. There's no need of any statistics or any study to prove this, because we all know how our screen time is, our usage at home is. There is an increase by 20%, which is contributed only by kids. There is increase in the number of apps, there's increase in the number of playing games, and so on. So the best way to cut down screen time is to increase family time, to reduce screen time. This is easily said than followed. So how do we go about it? First, you make a plan. Every day morning when you wake up, you make a plan on what each individual at home should do. Some particular job or painting or gardening or whatever it is, and give an allowance of 30 to 60 minutes extra depending on the job and depending on the age of the child. Don't be very strict with the timings, then you will become a mess. The aim is to keep them happily occupied and not to achieve targets. Your aim should be to decrease screen time gradually. Don't have to be really very particular that a child who was watching 4 hours per day, suddenly you make it half an hour. You will become stressed. The child is going to become angry and he's not going to listen anything to whatever you say. So decrease the screen time gradually. Involve them in your household chores. It really becomes a mess when the whole family is in the kitchen or when the whole family is in the cleaning room, but still you all did it together. You'll have that happiness. Create a family time. You go to the terrace or you go to the balcony, take the whole family with you, discuss some stories, play some music, dance, do some exercise, stretching, but with no phones or laptops. Then this actually gives you a lot of happiness. Always use open communication when you talk to the child and when you decide to give the gadget. Find out what they're going to watch or why they need that and how long do they want that. So if it is an elder child, give them a personal space. If you're very strict with them, they will find alternate ways how to access internet without your notice. So give them some personal space if it is an elder child, but be aware of what they are doing and use appropriate technology. The most important thing is spend time with them online so that you can have fun online along with them. This gives them positive reinforcement, so they'll mostly follow you without much difficulty. Yes, the next one is increase in aggressiveness. Children are the first to respond negatively when there is a stressful situation at home. Some kids become more defiant, that is, they don't listen to anything you say, they are just the way they are. And some kids are more demanding or more controlling. They decide what to eat, they decide what to do, and they decide what to wear and things like that. But few of them are more repetitive. They want the same kind of food, the same kind of game, the same kind of activity every day. Different kids behave differently. So how do we manage this excessive aggressiveness? Routine is the best key. This routine should be consistent but practically feasible. It should have both productive activities and it should have some downtime. How do we start? Be patient to yourself first. The moment the child starts becoming cranky or starts screaming or starts making a fuss, you scream and trying to dominate the kid and then to stop the aggressiveness. That's not the way we usually go about. It's easily said, but every time when the child becomes aggressive, if you remember this, at some point you will be able to achieve that and make the situation more calm at home. Be patient, take a break or give a break and let the situation calm down. Sit with the child and attempt to understand their frustration. We all know their frustration most of the time is not giving a phone or a laptop access nowadays. So also stay focused with the present issue. Don't bring about things in the past that which happened a week ago or 2 days ago, like breaking something or beating the other kid, something like that. Just stay focused with the present issue and look for various options to decrease their restlessness. This period, this lockdown time, parents have to sit with children more frequently than before so that this aggressiveness comes down. Remember, you are the model for your child's behavior. If you are screaming more at children nowadays, children are going to respond to you the same way with the same tone as you did to them. Coming to online school classes. the best aim or the best way to manage this challenge is keep your expectations low. It is new for the teachers and new for the kids as well. So if it is a younger child, sit with them during class and also accept that they cannot concentrate or either they get distracted very easily. Make sure that there's no disturbance and give them a good break before you make them do some homework. Please don't expect them to know all the topics or understand all the topics as they do when they go to a regular school. And if it is an older children, teach them how to sit in a comfortable position, posture, give them appropriate temperature and lighting, make sure that there's no disturbance, no TV sounds from the adjacent room. Make sure they have a good hydration and good sleep because this is going to increase your screen time as well. So hydration and sleep is very important. Also keep a track on what happens in the online class because this is also important. So next we move on to queries on handling daily use products. We definitely cannot be without going out, buying grocery or food from a restaurant. So how safe is it? We all know that how the coronavirus spreads, it's mostly through droplet infection. That is when we speak or when we shout or we cough, the droplets gets to the air, and sometimes when the droplets are heavy, those get deposited on the adjacent surfaces, maybe at a table or a door or a computer or a laptop or a phone, pen and other things. So the same can happen in shop depending on the type of shop. The cough or the secretions can deposit on different things like a fruit or a vegetable or a packet of grocery and things like that. So how should we be safe in buying all these things? Wear a mask when you go to the shop or when you go to a restaurant. Make sure, remember not to touch your face until you get back home. And in case you have to rub your eyes or clear your nose, make sure you wash your hand with soap or water or sanitizer before you touch the face. Go to the shop, make a list so that you don't spend much time inside the shop. Keep a good distance of 1 meter. Try and keep a good distance and buy everything. Come home, leave it in a separate place, wash your hands, remove your mask, wash your hands again, and then handle all these things. And when you handle all these things, there is a next doubt. Should I wash all the vegetables and fruits with turmeric, salt, soda bicarbonate, vegetable-based sanitizers, and things like that? See, the WHO is very clear, and there is absolutely no data on how this coronavirus can get transmitted through all these fomites like vegetables, fruits, and other packaged food products. It is very difficult to get any data, but there is a practical and a theoretical possibility that if the person who went to the shop before you had to sneeze or cough and his secretions had to get deposited on those particular things, and if you by mistake had to purchase the same thing, then you come home and you wash off your hands before removing your mask and before you handle things. Make sure that you wash all the vegetables and fruits as usual you would do even before the corona season and place them in appropriate places, and after handling them make sure to wash your hands again. There is no specific product or a chemical which can kill the virus on these food products because there are a lot of suggestions. Soda bicarbonate can kill. There's so much of confusion, but what chemical for how long duration is going to kill coronavirus, there's no evidence. But be careful in handling these. So the next question is, how frequently should I clean high-touch surfaces at home? High-touch surfaces are those which you keep touching it frequently, like the no doorknobs, switches, mobile phones, remotes, and things like that. If nobody at home goes out frequently, very often, or has any respiratory complaints, you really don't have to clean them every 2 hours or 4 hours once. But if you have gone out and come and you had to touch the doorknob and you had to touch the switches, then it is essential that you wash off your hands after decontaminating yourself. It is better to come and touch to clean off these high-touch surfaces with a disinfectant at home. So next one, how frequently should I wash my hands at home? There is a lot of FM ads and TV ads which say to wash your hands frequently. How frequent, nobody knows. So you don't have to wash your hands every half an hour. What they mean by frequent hand washing is every time you touch a surface. I'm in the hospital. I'm touching the table in front of me. I don't know who was here before. So I don't take my hand and to my face without washing my hands. This is the same. When you go back from home, go back from work to your house, make sure you wash your hands. And anytime when you receive any newspaper or any other parcel, then you leave it separately and wash your hands. That is that is what frequent hand washing means, not washing too frequently every half an hour or so. So before you, even at home, before you want to clear your nose or rub your eyes, make sure you wash your hands and then touch your face, because most of us don't remember what we touched earlier. So the next question, should I wear a mask inside the house? We all know it is a no. We have to wear a mask when we go outside, but there are few occasions where we have to wear a mask inside the house. Yes, if you have respiratory symptoms, cough or difficulty breathing, you definitely have to take a physician's advice. And if you're advised to stay at home, it is better you wear a mask, because even if you are infected, you might not want to spread the same infection to others. I see some amount of disturbance. I request every one of you to mute your audio so that we can answer your queries towards the end. So if you have a respiratory symptoms like cough, you have to wear a mask inside the house. And if you are taking care of a person or a family member who has respiratory symptoms, it is better you wear a mask as well. So finally, we come to some myths. Our traditional rasam, pepper, turmeric, garlic. Yes, all these are immune boosters. It increases immunity, but it has nothing to do with prevention or curing coronavirus. And pet animals, houseflies, and mosquitoes, they have not documented to spread coronavirus infection. Spraying of disinfectants over the body or or drinking them, consuming them, actually is more dangerous and does not give any benefit. Drinking alcohol does not protect you either. Exposing yourself to sun or temperature more than 25 degrees does not prevent you from corona infection, because if the person is already exposed, when he comes to a temperature, at a lower temperature, he has the same risk. When he coughs, he's going to expose you with the same infection, same organism, and so the temperature does not matter. We are not going to stay in the sun all the time. Hand dryers are not effective in killing coronavirus, so it is always advisable to wash your hands with soap or water or alcohol-based hand rubs. Drinking water or gargling your throat every 10 minutes will definitely not prevent you from getting the infection. Thermal scanners, which are used at shop entrances, hospital entrances, they just check only the temperature. They cannot detect coronavirus. To detect coronavirus, you either have to undergo a nose or a throat swab test or a blood test. HCQ, the hydroxychloroquine, which we were talking about a month earlier, has documented to have no proof on prevention or curing coronavirus. Children who are vaccinated against pneumonia and the H1N1 influenza virus does not have immunity against corona. But when these bacterial infections affect the system, then they actually develop comorbidities, so that they are at more risk to develop corona. At present, there is no specific antiviral drug which is effective to cure coronavirus, but there are numerous studies going on. There are various supportive care modalities other than the specific antiviral drug which is being used, and people are getting better from serious illness. And vaccine trials are going on. Nobody is sure, nobody can be sure until the vaccines are out themselves. So what is the ultimate prevention strategies? Physical distancing or social distancing, a distance of at least 1 meter, follow respiratory etiquette, that is, you cover yourself and cough at the elbow. Try to wear a mask always and avoid unnecessary touching of the face. This touching your face was nice. Always clip your hair back so that you don't have to take your hands to the face to push off your hair. And keep your hand always busy with some pen at the workplace if you're out of the house, with some pen or something else. And if you are in a place where you are expected to wear a glove continuously, wear some textured glove. You might not find it nice to feel touched with a textured glove. And there's another nice way to remember is to use some scented soap, so that the moment you take your hand, you feel sense the smell, and you remember not to touch your face. You can wear goggles, sunglasses. It's okay if you wear inside the house, inside the room. It's okay because it just reminds you not to take your hands to the face. So always remember to respect the person in front of you. He's also a human being trying to make a living in this pandemic. If you follow these prevention strategies, you are protected, and you can also prevent the spread of this infection. So what should we remember when this lockdown is lifted? Continue the same present style of living. Avoid crowded places, avoid inviting friends and attending large gatherings, have virtual interactions, and remember the same preventive measure. This is going to go on for next few months. Continue to work from home until feasible. This is the best time you can teach kids about the pandemic and how they can protect themselves, so that it becomes their routine habit when school reopens. So when you are called for work, or when you have to go for work, then carry only necessary things to work. Keep them in a separate place when you come back. Carry your own utensils, spoon, carry your own mobile chargers so that you don't have to borrow. Carry your own pen. If possible, leave it at your workplace. You don't have to carry it back home. After coming back home, leave your footwear outside. Leave the vehicle keys, mobile phones, and other personal belongings separately, so that it is not handled by the other people at home. Soak your clothes in hot water and wash it for 15 to 20, wash it after 15 to 20 minutes. Take a bath before you start interacting with your family members. On mobile phones, you can clean it with a sanitizer and leave it untouched for 15 minutes before you start answering calls or charging phones. Please don't do it immediately after using alcohol rubs on your phone. We have to practice it daily so that it becomes a routine. A routine which is followed daily becomes a habit, and then it becomes easy to do it every day. So when is the end? When an effective antiviral proves to provide cure, when an effective vaccine is available, when 60 to 70% of population has developed immunity, thus preventing massive spread of coronavirus infection among people. So when is either one going to happen? Nobody is sure. We are all working towards it, but the deadline or the time when all this is going to happen, nobody is sure. So remain motivated. This corona crisis isn't forever. We just have to get through it now, one day at a time. Stay positive. Remember to stay calm every day you wake up, and every time you become anxious, or every time you become stressed. Because our anxiety does not come from thinking about the future. It actually comes from wanting to control it, or from fear of inability to control it. So thank you. You can unmute yourselves, and I can answer your queries. If there is any question, you can text me as well. If there are no queries, then I'm going to answer a question from Deepika. So, hi Deepika. See, having febrile seizures is not a comorbid condition, or it does not pose an extra risk for the for corona infection. What happens is, she's like any other normal girl. If she does not have a wheezing problem or any other immunity related problems, she's going to handle corona like any other like any other well child. And now the next question is, now I'm in my native. You're going to planning to come to Chennai next month. It is too early to say how Chennai is going to be safe next month. So wait until the next month. We'll see how high the cases are going to go up, and then we'll decide. It is not an emergency to decide on coming to Chennai right away. So you can wait a while. And there's another person. How to make sure my 6-year-old son how to make sure that my 6-year-old son gets adequate physical exercise when at home? This is a nice question. If you have a balcony, you can take your son to the balcony, or if you have a terrace, you can take him to the terrace. Make sure that those places are not crowded. Your balcony might not be crowded as well. You can do a lot of sessions inside the house. You can make him skip, you can make him jump, you can do some lot of stretching exercises inside the house, and that's what we've been doing in our terrace since last 1 month. What are the precautions schools should take before reopening? This is a long way to go because once we are expected to reach peak somewhere around June end or July. This is an expectation, but we don't know what actually is going to happen. But the schools will start reopening only after we reach peak and we are on the falling curve. That time the immunity of the total population or the herd immunity would be a little better, so that make sure they follow the same preventive practices. When schools reopen, elder children, they can understand and they can follow things a little way better than the younger children. They should not share any water bottles, or they should not share any cutleries, and it's better they have a sanitizer in their bags, and they follow some social distancing. It is very difficult for schools to decrease the number of children in each class, but then there will be a way where the schools will reorganize, changing the time schedules and decreasing the number of students inside the class. But the same thing is, you wear a mask, you continue continue to follow the respiratory etiquette, and you also have to remember not to touch your eyes, nose, and mouth with your hands after touching the common places. There's another question. What is your advice? What is your advice? Kids tend to play in the apartment. These kids are curious and play in area. Also advice. It is very, very difficult to not let your kids play in the common area because you cannot control them for long. It is nice to hear that kids are playing together now these days, because here in Chennai, all kids are locked inside their house. But they have to be told or taught that they sweat a lot this summer. They cannot take their hands to their nose, face, and mouth without washing their hands. If they are very particular with this, I think you can allow, but too many children, it becomes they get lost in the game and it's difficult for them to play following all these preventive measures. So try and teach them more frequently so that they remember and practice it well. This is an
Hi,
equal
ma'am.
to
I have a question.
hi.
Hi. My question is the kids are kids. So when schools get started, they
Yes,
surely will exchange water bottle or eat others, do something. And I'm
yes.
I'm afraid if kids might get corona. I want to know is, are the kids are also having the same kind of treatment like adults? Like they are also in a separate place. They don't meet their parents. Is it so?
Okay, see, everybody has the same doubt, and your doubt is a genuine thing. That is why I said that they are not going to open the school right away. Only after we reach the peak and start coming down the curve, the schools will reopen. There's no hurry in opening the school, because older children, they will follow and they can understand what the situation is. Smaller kids, when you send them out of the home, they will forget. They are happy to see their friends. That is correct. But there should be a way where we should continue to teach them. We practice so that they see us and learn, so that they also start practicing. That is the main reason. That is the main thing we should do in this lockdown time to our small kids. And yes, if it is child who gets sick with the corona infection, these children are not put in isolation without any parent. We understand that children are anxious. So one of the parent is allowed to stay inside with the child, so that without moving in and out, they have to stay inside the hospital or inside the room or inside the isolation room with the child, so that the child feels less anxious. And yes, the treatment options are really good. Thanks for corona for coming to India a little late, because we've had experiences from different countries. So we are actually more open to different treatment options, and children are actually doing great. There's not much of mortality in children. So we have treatment options. Don't worry, children will not be isolated like adults.
Yeah, thank you. Thank you so much, ma'am.
Okay, anything else? Okay, there's another question where there is an 8-month-old girl who's suffering from cold. Okay, see, cold, it can just be a nose block, can be some cough. If you speak to your doctor, things might get more clear. She might just need some saline nasal drops for a cold to get cleared. It's better you talk to a doctor in person so that they can discuss your queries and give some appropriate medicines. Should I hold regular vaccination schedules for my 1-year-old child? Definitely yes. What the Indian Academy of Pediatrics suggests is don't stop any vaccination for a less than 1.5-year-old child, because yes, we don't come out more frequent, so the number of respiratory infections, number of gastrointestinal infections are less. But these vaccinations against bacteria, they're all airborne. It is better we give the vaccines, and hospitals of late have separate timings for the vaccination. So discuss with the hospital, discuss with your pediatrician which is the best time for vaccination, and please go ahead with vaccination. Please don't stop vaccination. A delay of 1 or 2 weeks in vaccination, it is still okay. If anyone affected with COVID-19, how long he should be in quarantine after he or she's recovered? Okay, this usually the incubation period is about a week to 14 days. After that, you start getting manifestations, and by the time you recover, it is going to take another week to 10 days. This we can find out by doing a repeat test where the throat swab or the nose swab, which had a positive PCR, would turn negative. With two negative PCRs, with the two negative tests, then it means that you have recovered from the corona infection. How do we boost immunity for a 4-year-old kid during this pandemic time? Okay, eat plenty of fruits, vegetables. This will have a lot of antioxidants and will take care of the oxidant stress in our body. That should be okay. There's no need to take any separate tablets like zinc or vitamin C. All these are for healthcare workers who are at higher risk than the general public. Can we send the kids, especially the lower grades, to school when there's still no treatment? The schools, yes, it is a difficult question to answer, but the schools and the government will not let the school open until we are down the curve. So maybe we would have an answer to this in the form of vaccine by the end of this year, or we would have different modalities of treatment. The next few months to come, we might also know how this organism or how this virus is going to behave in different groups, so that we'll have a better treatment modality. So at this stage, it's very difficult to answer this question, but in the days to come, we will have a better idea on how to manage, and we will have a clear idea on when schools will reopen, when the situation is in control with us. So next question is, what would be your advice on virtual classes? There is a lot of anxiety amongst parents. They are attending the class, but not allowing the child to be independent. See, online classes, keep your expectations low. This season, they're all are struggling. Is anybody there? Okay, I'm continuing with this query. There is a lot of anxiety on virtual classes. I totally understand this situation. Everybody is trying to do. Be strong and be positive, manage all anxieties, and continue a decent living. At this stage, keep your expectations a little low. Don't think that your child should concentrate and listen to the entire class and then complete all the portions. It's okay if he or she understands 50% or 60% or whatever. There's nothing to take it more seriously. Just sit with the child. You don't have to, if you have time, please attend classes with the child. If you think this is not going to help the child, please leave the child, sit in the class, or attend online classes without you, but keep an eye on the child to find out what the child is actually doing. You can later sit with the child and find out where is the anxiety or where is the problem, and try to help the child based on that. Will the children be treated if infected in a government hospital, or do parents have a choice to continue treatment with their regular pediatricians? This is a question a bit early to answer. At present, there is a government hospital and there are few private hospitals which have been recognized to manage corona positive patients. But when the situation worsens or the number of patients who are going to become infected with corona increases, the government has no other option to but to include other private hospitals in their treatment. But they will just make sure that if the private hospital is equipped or appropriately designed to manage such patients, in such a case, if you have any query, you can talk to your pediatrician and select a hospital of your choice to continue management. Next question. My kid is preterm and having less immune. Is she prone to flu on regular intervals? Now she's 4 years old. How to cope? Kindly advice. Usually a preterm, they are more prone to infections until up to 2 years. If they've had a good weight gain and they've had their regular immunizations, and I think at this stage when she's 4 year old, she's like any other child who is at risk of any infection like the general population. There's nothing much to worry about right now. How to take preventive measures after lockdown for daycare going kids. It's better you don't send kids. They might not even open the daycare until the situation is under control. Teach them all the preventive measures like washing their hands, wearing a mask or a cloth mask, or not taking their hands to the face, and not coughing into their elbows. You just have to keep repeatedly teaching them so that it becomes a habit and they follow it. Considering the current scenario, can we take our kids to normal checkup like eye, ear, etc. now, or should we wait till the situation improves? If it is going to be a regular checkup, I think you should wait a little more until the situation improves, because since last few days we see that the number is going up. So it's better for regular checkups to discuss with your doctor and find out the need for it. Do we have to take warm water only, or RO water will be okay in this situation? You can take water at any temperature. Warm water is not going to do any additional benefit. So if you're comfortable taking warm water, please take warm water. But if you don't want, you don't have to force taking warm water. Any water should be okay in this situation. So advice for parents of autistic kids, their therapies are disturbed, how to manage these kids? Is there some online support available? Autistic kids, yes, we you can interact with your pediatricians or a developmental pediatrician. This online support at present we don't have at Rainbow hospitals, but if you can call us and interact with us, depending on your locality, we can give some suggestions. Is it true that O positive are more immune to corona than? It's definitely nothing to do. There's nothing to do with the blood groups. Everyone is equally prone to coronavirus infection. Is Rainbow a recognized COVID treatment facility at present for children? At present, Rainbow is not recognized center government, but still we are equipped and we are appropriately organized to receive a patient. And in case we are ready, and in case the government is allowing us or making us eligible to accept such patients, we are ready with the treatment options. Can we delay the vaccination of our 4.5-year child since there's a vaccine due at this time? Okay. A delay of 1 or 2 months is okay, but ultimately you need to have the vaccine, because preventing infection from other bacteria is equally important, because coronavirus is not the only thing against which we should fight. We should fight against all of the organisms as well. So 1 or 2 weeks delay shouldn't be a problem. Is there
What
any
about breastfeeding during positive patients?
Sorry?
Breastfeeding in a COVID positive patient.
Yes. See, breastfeeding in a coronavirus positive patients. We all know that the coronavirus is going to spread only from our secretions. And when we touch, if our hands get infected, and through our hands it's going to spread. This is called fomite transmission. So you have to continue breastfeeding, but with precautions. Wear a proper fitting mask when you breastfeed your child. Before you receive your child, you wash your hands with soap and water or alcohol-based sanitizer and breastfeed your child. After breastfeeding your child, Don't remove your mask until you give your child to the caretaker. And this baby, it's better nursed in a different room than in the room where you stay. Your room has to be kept, the AC has to be switched off, and the windows and doors have to be open so that there's good cross ventilation when you breastfeed your child. You make sure that you don't directly cough on your child or your infected hands doesn't touch your child. This is the best way, and you should continue breastfeeding even if you have corona, if you're stable enough to breastfeed your child. Is there any online counseling cells available for child care? See, this question is not very clear. If you have a query, you can directly call the hospital, and you will be connected to a doctor, and your query will be answered more clearly. Can we give meat during the situation? Definitely yes. You can give a properly cooked meat during the situation. It's nothing to do with meat. Everything has to be cooked and clean. Thank you, doctor, for raising all the queries. Shedding. Okay. Thank you very much. Government has suggested Ayush Homeo medicine as precaution. Yes, government has suggested Ayu Homeo medication, but there is no data supporting that it will either prevent or cure corona. If you're happy with it, you can take it. But I'm not a person who knows about homeo medicine or who knows the side effects or risks associated with it. I'm not the best person, but without any scientific data, I would personally not prefer them. Can we continue the regular multivitamin zinc with regularly? Yes, zinc is a good antioxidant and an immune booster. You can continue zinc with regularly. There shouldn't be a problem with that. Should we go to the hospital immediately in case of fever? Okay. This all depends how old is your child. If your child is less than a year or less than 6 months, you think you're used to handling your child with fever, then you can safely give paracetamol, the dose prescribed by the doctor, and you can wait until the child improves or you are able to manage at home. But if the child has fever and you feel the child is not active or unusually lethargic, not feeding properly, having breathing difficulty, then you have to bring the child immediately to hospital. Fever itself is not a concern, but fever along with other unusual signs is a concern. So if there are no questions, can we log off? Yes. Okay. Thank you very much for staying with me. And thank you for patient listening.